Namaskar, this is Late Edition. On the show tonight, we'll discuss the challenges and the opportunities in the healthcare sector on the occasion of National Doctors' Day. Now, there is no doubt that we need to improve our basic healthcare services, but simultaneously, we also need to develop high-tech curative medical services for ourselves, also for medical tourism. Now, we need all types of healthcare professionals in our country, health workers, physicians, highly skilled physicians, scientists as well. Well, the doctor-patient ratio in our country is about 1:2,000. There are about 50,000 MBBS seats across the country and around 381 colleges, medical colleges that is, registered with the Medical Council of India. Dr. Aggarwal, would it be fair to say, and there are some reports that suggest that the unethical practices are increasing. Or is this a misunderstanding, because there is a feeling that medical practitioners always ask for lots of tests, they eliminate various other diseases before coming to one disease, and then the patient pays a lot of money as a result of this, and many people feel that these numerous tests
let me give you some of
are unnecessary. Is this a misunderstanding?
It is, because we can't generalize it, but we can't omit it also. We can't say that doctors are not unethical. Some of them are, but majority of them are not. So we should not generalize it. There was a study, there is a case going on in Maharashtra Medical Council where a doctor sent a complaint to the council that a diagnostic center gave him a cut. That case is on.
Okay.
A big hospital in Mumbai has admitted on record that they give incentives to general practitioners for 50 so much and for 75 cases so much. Medical Council is thinking of calling them, taking a strict action against them. If there are, because such types of cases, they spoil the image of the medical profession. So that's very, very true about it. And then there is the discussion going on in the last 1 week that unnecessary tests are going on. There is a campaign which started in US called Choose Wisely campaign.
Okay.
Every association, every specialty has been asked to devote 5 things, which has to be percolated to at the GP level, that what is necessary and what is not necessary. For example, the Choose Wisely campaign says in a low back pain, unless there are red flag signals or a back pain of less than 2 weeks, no MRI should be done.
Okay.
So they say in an annual checkup, no X-ray has to be done.
Okay.
It's not required. So today a study has come, they talk about in women who are asymptomatic, pelvic examination is not required. Do a pap smear, do a local inspection, but don't do a pelvic examination. That means a finger examination is not necessary. Okay, so recently the Indian government has come forward that finger test is not required to find out the patency of in a lady who is convicted of a sexual assault.
Right.
So lots of such things are now coming up.
Okay, fair enough.
Medical associations and the government together should come out with such types of things which they feel that over a period of time, there is evidence that these tests are not required. And if they can come up, say today what is required, a doctor also requires an impunity that if he doesn't do the test and something happens to the patient and he goes to the complaint against the doctor should get an impunity. Yes, there are guidelines. I am following the guideline, therefore I am secure from my impunity point of view. So I do agree there are some unethical practices, but majority of the time the medical profession was clean, is clean, was noble, is noble and will remain noble.
Okay.
So when in doubt, investigate.
When in doubt, investigate.
For example, if I have a clear-cut case of tonsillitis, I have no doubts, so no need for investigation, treat it. But when in doubt, do investigate, because that leads to Consumer Protection Act.
Right.
And second is that I personally feel if I really want to build up a patient-doctor relationship, I have over 1100 cases experience in Delhi Medical Council and the Medical Council of India handling complaints against the doctors.
Right.
I personally feel is that if you get self-ISO certified, self-ISO certified, ISO certified means jo bolte ho wo karo. So whatever you say, you do it. There will never be a confusion. So whatever you say, you do it. Whatever you do, you document, and whatever you document, you preserve for if there is a query with that. So that means if there is a communication between patient and doctor, whatever you say, do it. If you say 50,000 is the bill, it may be plus minus 5%. But if you say 50,000, it comes out 1.5% dispute. If you say you will be all right in 7 days,
Okay.
Tell the truth to the patient.
Okay. Tell
And
the
be
truth.
approximately to
Okay.
the patient-doctor relationship should
Right.
not suffer.
In fact, Dr. Trihana just said that the patterns of diseases have changed in our country. So, I mean, what do you think? We don't seem to have as many vector-borne diseases as
No,
we used to
vector-borne
have in the
diseases
past.
are there, but there are
but
emerging
there are more
diseases.
lifestyle diseases
There are
coming
two
up.
types of emerging diseases. One is
Yeah.
lifestyle, one is a non-community. The non-community are like, we have dengue coming in, we never
Sure.
heard about it in our medical college. We have chikungunya coming in, we have SARS coming in, we have bird flu coming in, we have swine flu coming in. But the lifestyle diseases are the new epidemics of the society. We have
Okay.
obesity, we have blood pressure. In my medical college, I might not have seen number of heart attacks in 8 years, which I saw on the first day when I joined Mulchand Hospital in Delhi.
Okay,
So
fair enough.
there is a paradigm shift
Sure.
in communicable diseases, which needs to be checked. Unfortunately, even today,
Right.
we don't have a national cardiovascular control program. Still, it is a small program which is being run by the country. The country has a program for cancer which is only 1%, but the country doesn't have a program for a disease which is more than 10%.
Dr. Aggarwal, I mean, in this critical mess, some people say that, okay, we needed to have a lot of more specialists, but we seem to have specialists now, and with the ones that are missing are the neighborhood family doctor. He's missing from the picture these days, and everywhere you go to, you find a specialist.
So I personally feel is that the family physician concept has to come back. If you directly go to a specialist, you will be in trouble, because you can't go for ortho another specialist, you go for ENT another specialist, you go for eye for another specialist.
Yeah.
They won't be able to talk to each other. They have no time. So you need to come back to the concept of family physicians. You need to have your GP. You have to believe on them. You put them on whatever way you want to have an association with them. If you have your local GP, he is the best doctor for you to decide from birth till end. Okay. Another important thing is that on Doctor's Day, what we particularly feel is that everybody has a fundamental right of a universal health care. Article 21, nobody should die just because he can't afford. Okay. In that way, we want affordable, accessible,
Absolutely.
quality and safe medical care. Magnitude of care may differ, but the standard of care should be the same.
Okay.
I run a NGO, Heart Care Foundation of India. Dr. Trehan is just running the Medanta. We have tied up and we declare on today, the Doctor's Day, that children who are suffering from heart disease,
Okay.
who need a open heart surgery,
Okay.
and they cannot afford, we collectively, our NGO and with Dr. Trehan,
Okay.
we are providing them a free heart surgery to the children. That's our commitment on Doctor's Day today. We announce it to the public, and if they have, they can approach us.
Right.
And we screen them, and then if we screen them, after screening we find that they're deserving, Dr. Trehan's team will do the free surgery to them.
Okay.
And that's our commitment. And if people like
And
him
how do they go
and
about
NGO,
this, Dr. Trehan? I mean, what is expected of the people if they have this problem?
No,
and how will they come? They
will
come to
go
his
the
NGO
heart-
first?
The
They
NGO
will come to the
first,
NGO.
The screening will be done, and then their diagnostics are done, and then we take over from there.
Okay.
So there are many, like I was saying, that there are many solutions.
You know, some of the concerns are of shortages are also with regard to the number of medical colleges we have, seats, and also the expenses involved in education. They are so exorbitant that you were talking about affordable healthcare. I mean, if we have to pay so much in our education, then how can the healthcare be affordable?
definitely everybody is concerned about the capitation fee. It should be transparent. There should be, even if the fee is uniform, but that cash component of the medical colleges has to go. Today or tomorrow it has to go, because that's what the public prevalent. Everybody says is that if the doctor is giving so much money to become a doctor, he has to recover, therefore he is becoming corrupt. That system has to become transparent. More and more private ventures will only come to make medical colleges if medical college norms are revised.
Okay.
The government has to come back, they have to revise medical college norms, so that more and more private sector, as on today, for example, why should only a society or a trust open a medical college? Why can't a company or a private limited company or a limited company open a medical college?
But the government is talking about
Why can't
certain-
Naresh Trehan or Dhirubhai Ambani open a medical college? Why he has to go through a trust and then divert the money? If he has to run a company in a medical college, why should he has to divert it and make it a trust and take out the money and becomes a corrupt person to do that? So there is a time to change. The Medical Council of India, the other people, industry, the government policy has to think together to come out with a policy where there is a transparency, And medical education is cost
Can it be
effective.
subsidized? Can
It has to
medical education be subsidized?
If you can subsidize oil, if you can subsidize oil, if you can subsidize LPG, why can't you subsidize the medical education?
Dr. Aggarwal, also the courses are very long. I mean, not that they obviously that's a profession that requires a lot of education, but the point is that teachers are a shortage, and there are some people who feel that retired people can actually come and teach. So why shouldn't they be allowed to teach? Or would one say that, you know, the medical practice has changed so much that a person who is retired can't be a
See,
teacher?
all this requires constitutional amendments. The council and the government together should think about it. There is a need for e-teachers. If Medical Council of India can come out with e-MCI curriculum, where every talk, everything simulation is available on the net, then the number of teacher requirement at every college will it will not be, you have the best of the teachers available on the net, because for 90% of the education is theoretical. Rest of the practice which you do practically, the teachers are in plenty. Clinical practice, the theoretical teachers are in deficiency. So if you can come out with the e-university of a Medical Council of India, where best of the teachers of the country, the lectures are recorded and they are available on the, and approved by the Medical Council of India, yep, the shortage of teachers can go away without any problem.
And this kind of technology support, Dr. Trihan, I mean,
And you can have the same teacher taking a class and all the 300 medical colleges hooked to the same teacher at the same time. It is technically
but
possible.
there's no
Why can't you do
interaction.
it?
But we are, I mean, even though you did talk about affordable healthcare, medical tourism is taking place because we are reasonably affordable compared to the rest of the world. What do you think is the future of medical tourism in our country?
Medical tourism is the future. But while medical tourism is on one hand, it has totally stopped people going abroad for treatment. There was a time we used to listen that every politician, the day he becomes a member of parliament, he goes with his family abroad for his personal treatment. That all has totally gone. We are one of the best. We have the best of the services. We have the best of the technology available. And now people from the West have started coming in. I am aware of a lot of patients who are NRIs, who are coming back to India, getting their parents treated here, getting everybody treated here. Even foreigners in any way, from African countries, from Nigeria, from Arabian countries, from Pakistan, from Bangladesh, everybody knows that these people are coming. But the day we find that there is a shift from US, instead of going to their neighboring countries for surgery, if they start coming here, and that will be the real challenge for the country.
Right. Finally, Dr. Trihan, in medical tourism, I mean, is the profit motive, is it important for the
Well, you know, it is, you can
mean, you're running
charge,
a huge,
you can charge a little more, but it also, you spend a lot more on providing the services like interpreters and things like that for when people come from different. So I don't think it contributes that much, but it does two things. One, it gives you, your institution, the ability to maintain the services at a level where they are acceptable internationally, which is a good thing. So we have, you know, we like some of our institutions have JCI, which is Joint Commission International certification, which says that you are equal to anybody in the world. The second thing is that it gives the pride of India to the rest of the world.
Right, absolutely.
So my belief is that we have a 4 billion people opportunity.
Okay.
Not only that they physically have to come here today, because in my own lifetime, I was in the US,
Yes.
I've operated on several thousand Indians who traveled from India to New York for me to operate on them. Today they are coming here, which is a great feeling for India.
Wonderful.
But I'm saying 4 billion people need healthcare as much as India needs, and they are deficient. India actually is a little ahead of everybody else. So we can be to the rest of the world what America and Europe is to us. So we can actually create models of healthcare delivery which will be applicable to Africa, to CIS countries, to Southeast Asia, and that opportunity we should not miss.
Just want to add, shortly I want to add. Yesterday I was listening to a lecture which talked about the robotic surgery, and they said 100 cases is the learning curve. That means you learn, you become a robotic surgeon after doing 100 surgeries. Therefore, the time has come when you want to work on medical tourism, the time has come that every hospital should say that why they are the best. That they say that we have so many, our doctors have so many years of experience, so many cases of experience. Otherwise, what is happening is people are going to a hospital, somebody has just joined, and he starts promoting himself as if he has done for 50 years, and the patient ends up into a problem.
The experience is very important.
So we do want a quality care which is safe. And safety will come with experience. Therefore, those hospitals who are not doing a good number of volumes should share them with other experts.
And that's coming from the member of the Ethics Committee of the Medical Council of India. We leave it there. Thank you very much, gentlemen, for being with us here on Late Edition. Well, the battle against disease cannot be won without an adequate army of health workers at all levels. And India's healthcare sector is at various stages of development. We face a shortage of specialists both for rural and urban areas and urban services. Our community health centers almost always lack specialists. Hence, such services are not available in villages. Now, on the other hand, we have a sizable number of super specialty hospitals also that promote medical tourism in India. But we need to realize that no battle in human history has ever been won by ill-trained armies. Similarly, India's health sector woes cannot be solved by ill-trained doctors. Thanks very much for watching. Namaskar.